Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a fully blocked left ear and a semi-blocked right ear. When the patient attended, I cleared their right ear first, but I'm going to reverse the order for you here so you can see the left ear first, which is a bit more interesting. So this left ear, as you can see, it's fully blocked with soft wax and keratin. And once I remove this, you're going to see what we call a keratin trail. So if you're a keen follower of the channel and you also listen to the audio, the narration, you'd be aware that the ear canal and also the outermost layer of the eardrum is lined with a layer of skin. It's called the epidermis layer of skin, and it's made up of epithelial skin cells. And this epidermis layer of skin, as it dies and replaces itself, the old layer of skin slowly moves sideways as it's shedding and eventually out of the ear. And this process starts from the center of the eardrum. So if you think about the eardrum like a pond or puddle, and then you have a pebble and you drop it in the middle of this pond or puddle, you'll have this ripple effect. Imagine those ripples being dead skin that's slowly shedding from the center in a radial manner outwards towards the edge of the eardrum and then to the ear canal, and slowly making its way across the whole entire length of the ear canal until it's exited the ear. And this process, it takes around 10 to 12 months. So the rate of epithelial migration, so the shedding and movement of the skin out of the ear, is between 1.5 and 3 millimeters a month. So it does vary. On the average ear canal length, it's about 2.6 centimeters. So here you're going to see it in a moment, some skin that has died and it's migrating slowly across the center of the eardrum to the back part of the ear canal. So we're going to peel that away actually. It's not often you can see it, but you can see it in this particular case. So we just got some skin on the cartilage portion on the posterior edge of the back portion. So I'm just using a hook trying to get underneath it to lift it away. And you're going to see how we're going to do that in a minute. So I'm going to be careful that I don't embed the tip of the hook into the skin of the ear canal. Otherwise we'll be cutting into it. But I'm just going to get underneath it and lift it upwards. And you'll be quite surprised at how much skin is hiding away here. You can see I've managed to lift that all off the back part of the ear canal. I've then reverted to the forceps to get a good grip and slowly peel this away. I'm going to use the forceps again, just a bit more dead skin on the back part of the ear canal. And then there's just a bit of skin here at the entrance. I'm just using the forceps for that. I'm slowly just applying a bit of pressure, because on the cartilage portion of the ear canal, we can apply a bit of pressure, but we wouldn't be able to do what we just did on the bony part of the ear canal, because that'd be really uncomfortable for the patient. So we're going to enter the ear, and you can see this skin here on the back part of the ear canal, and it's actually lifted off the surface of the ear canal, but it's probably making it halfway in its journey. We're going to just peel that away, and there is a little bit left, but we're going to leave that. We're going to just allow that to naturally migrate sideways and outwards. And it could be that this piece of skin is migrating slower than normal, and because it's a slower migration rate, the skin can kind of gather up and it can oxidize and it can crust, and I think that's probably what's happened. So the back part of the ear canal and the floor of the ear canal has a reduced blood supply compared to the front part of the ear canal and the superior part of the roof, so that sometimes can lead to a slower migration of skin. So the left ear is clear. I'm just going to do their right side. So here there's a bit of an opening at the top, so I'm just using the Jobson horn. I'm getting over it and then under. And again, this is pure dead skin, whereas there's a bit of wax in their left side. This is predominantly dead skin. So the eardrum's already fully visible, but you can see this patient has undergone some trauma to the eardrum. The northern hemisphere, so the top half is tympanosclerotic. So there is some scar tissue there, which is a buildup of calcium deposits in the middle membrane of the eardrum, which is made up of fibrous tissue. So the eardrum, it's three membranes thick. The outer layer, as I described when I was performing the left ear procedure, it's the same skin that lines the ear canal, so an epidermis layer. Then you've got the innermost layer of the eardrum, which is a mucosal layer, similar to the skin that lines the inside of our nose and mouth. So it's more secretory. And then you've got the middle membrane, which is made up of fibrous tissue. And in response to trauma or surgery, there can be a calcification, so a buildup of calcium that then deposits in plaques in the middle section of the eardrum. We call that tympanosclerosis. Actually, the technical name is meningoSclerosis. Tympanosclerosis is when the scar tissue also affects the ossicles. And meningoSclerosis is when the scar tissue is just on the eardrum. But within the profession, it's normally just described as tympanosclerosis. At least amongst audiologists, I suspect with the ENT, it's a bit more specific in the definition. So it's just some dead skin posteriorly. I'm just going to apply a bit of pressure. And just applying a bit of pressure is actually going to release this. There's quite a thick layer. Again, we're on the cartilage portion. If this is on the bony part, we wouldn't be able to do this. And where we are now, this is the boundary. This is where the cartilage portion meets the bony part. We call that the osseo-cartilaginous portion. You can see that skin, just a bit of pressure, it detached itself. And we've got a thick blanket here now, all gathering. And it came away with relative ease. Just a bit of dead skin at the top. So I'm just wiping around the edges. Now sometimes with skin, if you know it's shedding, now that piece there was actually shedding, it's sometimes just a good idea just to put it back in place, because that skin, as you see, it wasn't oxidized, it wasn't a thick layer of skin. And just putting it back in its place, that migration will continue, and that's healthy for the ear because any wax sitting on the surface is naturally transported out of the ear. So we just reposition that. You can see all that dead skin there. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.